Hi, everyone, and thank you for joining us here today. I'm your host, Leah Masten, for Top Industry Professionals TIP International Radio Podcast, where we are here showcasing prestigious top professionals from all industries all over the globe to share their experience and stories of success. My amazing co-host is here with me, and we are so honored to have her as a host of the show. Originally from Namibia, she was crowned Miss Universe in 1992. Please welcome Michelle McLean.
Hi, Leah. Hi, listeners. It is so amazing to be here today.
So happy to have you. And we're so excited for our amazing guest.
Yeah, we have a very special guest today. I don't know how he found time to be here with us because he's so incredibly busy. He's joining us from New Jersey, who is a leader in the healthcare industry. He's the director of high-risk PCI and research at Robert Wood Johnson Barnabas University Hospital, clinical associate professor of medicine at Rutgers Medical School and Robert Wood Johnson University Hospital, and practices at the Heart and Vascular Institute of Central Jersey. He was also selected this year as Top Interventional Cardiologist of the Year by IAOTP. So everyone, please welcome Dr. Ramzan Zakir. Thank you for joining us today.
Thank you for having me. It's a pleasure.
Great to have you.
You have got accolades that go on and on and on. Where do you find time for yourself, I wonder?
Yeah, that's a great question. So, I mean, it's... I pretty much go nonstop. So when I'm not working, I'm spending time with my family, going to different outings. I'm a big sports fan. So, I got season tickets to the Yankees, the Jets, the Knicks and stuff. So yeah, I keep myself busy, keep myself going to try to make time for my family as well. And, make memories as well. As you know, this time you don't get back. So.
Absolutely. So you have over a decade of experience as a world-renowned cardiologist. Tell us what got you involved in this industry. Was it always the career path that you wanted to lead?
It actually was. So my parents, they wanted me to become a physician, but as we know, that's not enough. It's got to come from you. So I always enjoyed the sciences as a kid. And then, I did some volunteering in a hospital. I worked in the transport department, and I really enjoyed, the atmosphere in the hospital. How it was a team approach. I saw the doctors doing their job, the nurses carrying out the orders, and our little job that we did, making sure the patients got through their exams, safely and returned back to their rooms. And so I had that, I checked that box that, okay, I like being in the hospital. I like sciences. And, I shadowed, a family friend who's a physician, and, I enjoyed that time. Then when I got to college, I did some research at Columbia, and I developed a very strong mentor in Saud Sadiq, and, got a paper published. And so then, I was pretty much totally in.
My gosh. So you have had a really incredible experience all your life in this industry. But so what is a typical day for us who don't know what it's like to be a doctor and a professor at your level? What does a typical day look like in your week?
Right. So a typical day, I've made some changes. So, the one thing that came out of COVID that, it gave me a little time to reflect and look at yourself and look at myself and stuff. And so I made some changes and stuff and started taking better care of myself. Exercising, regularly and eating better. So now my day starts really early because the only time really to exercise is if I get up early. So I get up at like 5 o'clock, and I've, added more stuff to my home gym. So I head down into the basement, I work out, and then my first case is usually at 7 a.m. So once I get that done, I may be a minute or two late for that 7 a.m. start, but, I do my best to get there on time. And, on Monday and Tuesdays, I'm doing procedures all day long, from 7 to usually, 7 or, on Mondays, maybe even a little bit later. And so those are my, the Monday and Tuesdays. And Wednesday, Thursday, and Fridays is a mix between seeing patients in the office, doing some procedures and still rounding in the hospital.
I wanted to know how long, what is the longest you are able to actually be in a procedure?
So that's a great question. So the procedures vary due to complexity. So, some of the more straightforward cases, you can do in under an hour. And then some may require more time. And that's, really my focus is on more of the complex disease, where not everybody has a skill set to really perform those procedures safely. So I do a lot of high risk, complex work, and those cases sometimes can take 2 to worst case 3 hours.
Wow, to be there for that long, concentrating, I just don't know if I'd be able to do that. I don't know about you, Leah.
Yeah. Now, 20 minutes is all I got.
Yeah.
It's when it's comes to telling the patient, yes, I was able to successfully complete the procedure and not, so that's a big motivation for me, because the patients are really trusting in me, and having a successful procedure and not is a life-changing event for the patient. So I'm committed to do all that I possibly can to help the patient.
Tell us about how it's been over the past 2 years with COVID and how it's affected you working in the hospital, professionally and also personally.
Yeah, no, I mean, that was, that was a big change, a big hit when it first came about. So initially, things were totally shut down. The first 2 months where the cath lab was shut down, and elective cases were kind of put on a hold. Because all the focus was on all the COVID patients and how to take care of them safely, and so I actually did have a little bit more free time on my hands, for sure, and what emerged during that time was telemedicine. So even for that period of time, we weren't even having patients come into the office. So we developed a lot of different modalities and how to still engage and interact with our patients. And during that time also posed a big challenge to patients that I actually wrote a paper on, was that a lot of those patients were having heart attacks, were actually presenting late to the hospital. They knew that something was up, but they just had such a fear of getting COVID that they would come in much later. A lot of patients even died at home out of fear for COVID. So there was a lot of changes that initially hit, and then we had to spend a lot of work trying to communicate with patients that we have measures in place that we could still safely perform our procedures and minimize their exposure as well.
Are you still seeing a backlog, or are patients still having to wait for some surgeries right now with how COVID is?
I think from the first surge, we learned a lot. And we've had a few, the second surge, we never shut down again. I think we just, after the first surge, we did shut down a little bit just to focus, on everything. And, we learned from that. And so we haven't stopped doing elective cases. So, I mean, I have a lot of patients that need to be scheduled for procedures, but not necessarily a long, backlog anymore like I initially did. At first, yes, there was a big backlog.
Sure. Well, I have great admiration for all the challenges that you not only daily have to go through, but now with the COVID pandemic. My gosh, sounds like you have been very, very busy. Now, throughout your illustrious career, you have won many numerous awards, honors, and been featured in magazines. And this year, you'll be honored by IAOTP's annual awards gala at the Plaza Hotel for your selection as top interventional cardiologist of the year. You also appeared on the famous Reuters billboard in Times Square, and you graced the front cover of Tip magazine. Well, congratulations. That's very impressive indeed, and well deserving. What would you say has been the highlight of your career, the most memorable experience that you've had?
Sure. I mean, it's tough to match being on the in Times Square on the big billboard and stuff on the Reuters. I mean, that was an amazing experience. I definitely want to thank IAOTP for that honor and stuff. That was fantastic. But to me, actually, it's the little things that really mean a lot. So I do a lot of teaching, and when my fellows, they go out and they practice, and then they reach out to me and said, I was able to do that case. I remember what you taught me. And I do a lot of courses where other physicians come in and they learn different techniques. And when they go out there and they're able to perform and help other patients, well, that really means a lot. It's so I think that the teaching component and the recognition and just the fact that they're able to go and help other patients, that means the most to me.
How much of your time do you spend teaching?
So that's a great question. I mean, there's a lot of things I'm trying to juggle because, I do have a private practice and I have a voluntary faculty appointment. So, but I still spend a fair time, teaching. So on the Monday when I'm in the hospital, all day long and, doing cases, the fellows all work with me. And then I attend conferences that I run. And, I hold a lot of educational programs. Me and two other friends founded, it's called the Garden State Angio Club, in which we show different cases, and we hold it like every quarter. And we have a lot of physicians, a lot of fellows come, and then we put up, cases and just throw out, what would you do in this situation? And, we've, brought that up to having a large conference that we're going to call Cores at the Shore, that we were going to have. It was all booked and confirmed, but then when COVID came, we had to put that on the back burner. So now we're going to look to bring that back. So I spend a fair amount of time teaching as well, and some of the fellows rotate with me in the office as well, and the residents and students as well. So a lot of time is spent teaching. Usually when I'm doing a case, there's often teaching involved with that as well.
You're also really active in your community and with other organizations. Tell us about some of those.
Right. So there's the American Pakistani Physicians Society, and they asked me to do lectures for them, and I'm always happy to to help them out. So yeah, I try to give back to the community as well, or local mosques and everything, and when they want me to do some education on cardiovascular risks, I go out there and speak to them as well.
What would your advice be to somebody who wanted to start in your field?
I mean, I would say, make sure you're doing it, for yourself, not to please somebody else. I mean, there's got to be a passion there. And I think once you have that passion and love for the field, I think just follow your gut, follow your heart, and, you'll be fine. It's a great field. Certainly there's a lot of challenges in the whole process, but there's nothing better than helping other people. And, I think, if that's your goal and stuff, you're going to be very happy and successful.
That's really great advice. Wonderful. Thank you.
Now, you already talked a little bit about some of your hobbies, what you like to do in your pastime. What else do you like to do for fun, or do you hope to accomplish in the next 5 years?
So like I mentioned, it was sports. So I still play basketball regularly. And, I put a court in my backyard. It's a sport court with full court basketball and tennis. And so those are my two passions, two sports I played competitively growing up. And, my sons, they play basketball as well. So we have nice battles out in the in the backyard on the court. And I just got a tennis ball machine. So I'm out there hitting balls, which is nice. But, so I've done, I've had some success in those sports and football. Was able to throw a football 60 yards and stuff. But the one sport that's given me a lot of problems is golf. So as far as what do I hope to accomplish outside of medicine is, to really get my golf game and become a really good golfer in the next few years and stuff. So it's been a frustrating sport. It's been humbling, since other sports I pick up pretty easily.
Curse.
Well, Dr.
Very,
Zakir,
very humbling.
Dr. Zakir, you could probably go to Leah's husband for a few lessons, because he's a pro golfer.
Oh, really?
Yeah.
It's my game, so I don't know. He might be able to help you out.
Okay, that would be great.
Yeah.
Yeah. So scratch golfer in 5 years. That's my goal.
Yeah. Hey, that's an aspiration for sure.
I have to agree with you with the golf game. I've been holding golf days for years with my foundation in Africa, and I've just only ever ended up being a caddy. That's just as far as I just don't have the patience at all.
All right.
But Dr. Zakir, so besides improving your golf game, what other accomplishments would you see in your field in the future, if there was something that you'd like to achieve?
Yeah, I mean, definitely continuing, everything I'm doing on an academic level, being, we're looking to get involved in some major clinical trials. And I definitely want to, continuing being on the forefront of the field, advancing technology, educating other fellows and physicians, and I have an outpatient facility where we perform complex endovascular procedures called CVI, cardiac and vascular interventions, and that's really come along nicely. Especially during times of the COVID, where patients can get procedures done without having to go into the hospital, and it's a nice atmosphere. So, that's been a successful venture that, I've launched in the last 2 years as well. So continuing to grow that out. And just that I'm, holding, courses regularly where other physicians and fellows come in, and just continuing to educate. And that's it. Yeah.
Well, I can see you're very passionate about your work, and I was very fortunate to work with the Professor Chris Barnard, the first heart transplant
Wow.
in the world. He actually helped me with part of my foundation, which was a heart of a child. So we saw about 26 children getting heart operations, life-saving heart operations, not necessarily transplants. What would you say was your biggest inspiration for you to be in this field? Was there any in particular individual?
There was an experience, I could say, that, really made me want to become an interventional cardiologist. Was when I was a medical student, and I was doing a rotation in cardiology. And I remember, we were just on the floor with the interventional cardiologist just talking. And then he got a call to go to the emergency room to assess somebody that's having a heart attack. And when we got down, we saw the patient was having, severe chest pain, was very unstable, not looking great. Brought the patient to the cath lab emergently. And I watched him, perform the catheterization, place a stent in. Then when I saw the patient afterwards, the patient had no chest pain, all the blood pressure, everything was so much better. And I followed that patient, and just to see how the patient was, before the procedure and afterwards, that kind of motivated me that, this is something that I could see myself doing.
That's incredible. Well, very inspirational. I've had first-hand experience of the successes, having a child 20 years later write me a letter and say, thank you so much to you and the doctors for seeing us through. Just really heartwarming.
Right.
I have another question. I know you're fluent in several languages. When you do your conferences, do you ever present in any of them?
Fluent's a strong word.
Oh, okay.
So I was born here. So, I speak my languages and stuff, but I speak it with an accent. So when I have lectured in Pakistan and India and stuff, it's actually, everything has been in English. So no, I've never,
You've never had to.
No, even when you go to other international conferences, that I've been, some of them, Spanish, some of them, what they do when I've gone to Latin America to lectures that, they have some lecturers that are fluent in Spanish. They have spoken Spanish. So what they do for me is, they have it, a translator set up.
Translator.
Yeah.
And now with Google Translate on our phones, you can pretty much go anywhere.
It's amazing, isn't it?
Technology has just really, been incredible. And over the years, have you seen in your field technology just go from, leaps and bounds?
Absolutely. And that's the exciting part, of where, the era that, that we're in right now and stuff like that. We've seen technology just from basic, TVs, from video games to where they've gone right now. In the medical field, we started off with just, doing just with the balloon was like a major breakthrough that you're able to open up an artery. But the problem at that time was that, a lot of times the artery would tear, and some of those patients would have to go for emergent surgery. Then the big thing was the development of stents. But the problem with the original stents, they weren't drug coated, right? So they would block up again. And then once we were able to put the drug on the stent, and that was the big changer, right? So now you're able to seal up that damage you did with the angioplasty and put a stent in, and the drug then keeps that stent open for a long period of time. And that drug technology we've adopted to treat patients with blockages in their legs as well. No, it's been exciting. So, technology is constantly evolving with better, equipment and ways to treat, some of the more challenging lesions are dealing with calcium. And when it's like trying to deal with rocks. So now we have new devices to break up that calcium as well. So, it's constantly evolving, and it's great to be on the forefront and be able, to offer this to my patients, early on in the earlier phase. Yeah.
Brilliant.
Go ahead. Go ahead, Michelle. Yeah. Oh, I was just going to ask if there was any one procedure that you primarily do over other procedures.
So So I focus both on patients with heart disease and vascular disease. So, and it's kind of equal, my passion for both. It's kind of swung a little bit towards the vascular component of it. So, people who have blockages in their circulation in their legs, who are suffering from excruciating pain, who have wounds or ulcers that are non-healing or at risk for amputation, and to intervene, it's very gratifying because a lot of these people can hardly walk a half a block, and you perform this procedure, now they're able to walk without any limitations. And people who have been told that they need an amputation and see me for a second opinion, and we're able to perform a procedure and salvage their limb, and just how grateful they are afterwards. I mean, it's fantastic. Then obviously, of course, I still take call for the acute heart attacks, and and do that as well. So it's so those are the main things, and it's treating a lot of the patients who have more complex disease where other operators are not that comfortable in assisting and doing those procedures.
I've been very curious. I know that. Sorry, we do have to end our interview very soon because I'm sure you have a very busy schedule this afternoon. But I've been very curious about, with the COVID vaccine having shown with some of the vaccines a problem with thrombosis issues for some patients that have a sensitivity towards that. What would you say to that?
Well, I would say we saw more of a thrombosis issue in the initial phases of COVID. So, I mean, that was more of the, I would say the real surprising thing that we weren't expecting from a virus. What these patients were coming up with thrombotic issues. A lot of patients lost their limbs and had strokes, and so I mean, that was in the first stage. But we learned now to treat those patients with blood thinners early on. And the thrombosis with the vaccine are far and few. I mean, you're talking about just 5. With the J&J had that little halt and the vaccine. So I mean, to be honest with you, you do see some patients who have some sort of side effects, but the vast majority of all patients who get vaccines don't really have issues. And so we haven't really seen a thrombotic issue with vaccines. We did see it during the initial surge, the first phase of COVID, though. It was horrific. It was one of the worst things I've ever seen. It was the worst thing I've ever seen.
Gosh, well, thank you for being there, being of service to our country and helping us through the time.
My pleasure.
And it's been so wonderful chatting to you today, Dr. Zakir.
Likewise.
If anyone would like to get hold of you, how would they contact you?
So my office number it's pretty easy, 732-99-HEART. So 994-3278. And our website's njheartandvascular.com.
Wonderful. Well, for any of those listeners out there that want to reach out to Dr. Zakir, here you have it. And thank you so much again for being with us.
Yes,
thank you for having me.
much.
It was a pleasure. Thank you.
Thanks.